And so the reason we're treating Carol with some Sculptra is because when we look at her, she has great cheeks.
Beautiful.
And beautiful cheeks, but she's starting to get a little hollow in her temple. And then she's also getting a little hollow in what we call the preauricular area, or just a little bit more fullness in there would make her look a little more youthful. Well, actually, after the age of about 30, we really start losing a lot of our facial fat, and you also lose bone density and bone mass as well. And so we notice it most prominently with Carol in the temple area.
Right.
So I think that what we'll do is we'll replace that with Sculptra. It takes about 8 weeks before we start noticing that she starts making her own collagen and elastin. So we usually bring them back at about 8 weeks, and then we take a picture and we look at the before pictures and compare them to how she's looking now.
Okay. Now you mentioned the collagen and elastin. So I heard that this is one of the only FDA-approved drugs that actually causes your body to create its own collagen. Is that right?
That's right. I think all the others are really just fillers. That's truly fillers. So they work and then they dissolve. This actually continues to produce collagen, actually probably up for a good 9 to 10 months, and then lasts for over 2 years.
Wow, that's a great treatment.
It's a great product. It's my favorite. It's the most natural looking of all the products that we use because it is your collagen. Okay, so what I've done is we've wiped her off pretty good, but we're going to do a little bit more. We really do want to prep the skin and get it very clean. So in our practice here, we use chlorhexidine or HipaCleanse, and we use alcohol and really get that face clean. Now Carol has been sitting with topical numbing of betacaine, lidocaine, tetracaine preparation on her face to help with the discomfort. This is a lidocaine, so here's what I'm going to do is I'm going to go ahead and give just little injections in the areas that I'm going to be injecting with a little bit of lidocaine. How bad was that, Carol?
Not bad at all.
Yeah, if you inject slow, you really don't feel it too bad. Deep breath in. I think breathing really helps too. And blow out. Deep breath in. And blow out. Deep breath in. Blow out. And this last one that really kind of smarts. Deep breath in. Blow out. Okay. That one hurt, I know. Not too bad. Okay, we're going to let Carol sit for a moment and let the anesthesia begin to work. So I'm going to start with the temple area, and you're going to feel me like a little pressure as I go in. Deep breath in. And then we aspirate to make sure we're not in a vessel. And then we inject. What do you feel? Just pressure?
Just pressure, no pain.
That's amazing.
Yeah.
It is amazing.
And here's another factor. There is actually lidocaine mixed in with the Sculptra. So you are going to be very numb by the time we're done. And Carol's issue, I think, is that we see a little bone loss. So when I inject here, we're going to get some projection in this area, and you're going to see that her nasolabial fold or her smile crease diminishes.
It'll get lifted, right?
It'll get really lifted, yeah. Because what I notice after using this product for 8 or 9 years is that the more that we put in initially, the more collagen we can get to stimulate. So that's usually what I do, and often then I don't have to retreat.
Oh, that's interesting.
Yeah, so I think if a patient gets 4 vials at 4 different times, they'll get better results getting three initially.
Right off the bat. You're doing the preauricular area now, Mary?
Yeah, now I'm doing the area where she's beginning to hollow, just to make a better transition between her cheek.
Now we're going.
Now we're going to continue injecting in this preauricular area where she has some volume loss.
Now we can see the product instantly, Mary. It looks a little lumpy right off the bat, but it just kind of goes away very quickly, right?
Yeah, what you're really seeing is just the volume. It's the water that's mixed with Sculptra because it comes as a powder. So all that goes away, and then you're just left with the particles, and the particles are what stimulate the collagen. So unlike a dermal filler like Juvederm or Restylane, it doesn't have to look perfect when we do it because it's just water that's going to dissipate anyways. Then those seeds will sow.
It's like planting grass in
It's
your
like
yard.
planting grass. I always say it's the difference between sod and seed.
So dermal fillers are usually hyaluronic acids, and this is a poly-L-lactic acid.
Correct.
Two totally different products.
Okay. So as you can see on her right side, she looks more volumized. She looks like she has a little bit more volume compared to the left side and a little bit more lift, as you can notice from the left side.
Nasolabial fold is practically gone.
Yeah,
That's
yeah.
amazing.
And she will look like this in 8 weeks. I don't really foresee us having to do another treatment, or if we do, maybe only one vial.
Wow, beautiful.
So I finished one side, and as you can see, the right side looks a lot more lifted than the left side. The smile line or the nasolabial fold is almost completely gone. The temple looks much fuller, and here's what really matters. I want Carol to look at it. Do you see the difference between one side?
My. Really? A
Yeah.
lot of difference there.
Mary, how many patients have you treated with Sculptra in your practice?
Thousands. We're a very big utilizer of Sculptra. I think right now we're the #2 in the country here at Advanced Aesthetics.
Wow. That's a lot of Sculptra.
It's a lot of Sculptra.
That's a lot of pretty people running around.
Yeah, it really, really changes the skin texture of the skin. It creates such a nice type of collagen that's a very youthful. So a lot of patients, not only do they see the volume changes in their face, they feel texture changes as well, which is, really, really nice.
Right, that's the elastin working.
Yep.
What I love about the product is just the really natural look that you get from it. People it takes years off of people's faces, but they don't look done.
Well, I think that's because of it is their own collagen, and it's
Right.
not a filler. Often when we use too much of our traditional dermal fillers like the hyaluronic acids, we can get kind of a doughy look to the face when you have too many in. At least that's what I've seen. Other products just don't lay very well, so I think Sculptra is the product of choice for this area. When I started in aesthetics 15 years ago, a lot of this we didn't even realize about aging. We used to do exactly what the patients saw, right in the middle of the face. Now it's the last thing that I usually take care of. I like to correct the frame. This is going to help the line right in here of her cheek. Especially when she smiles. She'll thank me. Now what we do is I massage the face. This is just an important component, is that we want to really make sure those particles are evenly distributed throughout the face. And now what I'm going to have Carol do is for about 4 weeks, I want her twice a day to rub her face, in the morning and at night. And so in my training from a very prestigious, well-known Sculptra injector in the world, Dr. Danny Villegar, he told me he has better luck with patients just massaging their face twice a day for 4 weeks, because it does stimulate for quite a while. So we really want to make sure that the particles are evenly distributed. All right, Carol, let's show you the other side of your face.
It's amazing. I love it. Thank you.